Hi, I'm Tammy Johnson. I just wanted to show you a close-up version on the male peri care. The male peri care and the female peri care are separate skills, so they need to be done, could be done separately. We're going to take our washcloth, and again, this is one time that we won't make a mitt. Now, in your skill book, it says to wash down, and the reason it's saying is wash down is because you're holding the penis up and you're washing around the tip. If the foreskin is there, you're going to need to gently remove it back and then wash around. And also, if the foreskin does not move back, be sure to notify the nurse and do not force it, okay? So then we continue to wash, holding the penis up, and this is what it means when it says downward, because you're holding the penis up because you don't want to bring anything down into the meatus. We're also going to wash the scrotum. They were not particular in the skill book on that. So wash the scrotum and be aware of any redness or irritation. Another washcloth, repeat that process with just rinse water. Again, pulling that foreskin back and then replacing it if necessary and moving from the meatus downward is what your skill book is talking about. Washing the scrotum, again observing for any irritation or redness. Thank you.